Welcome to Diplomatic Passport, where we give you daily weekday updates on COVID-19 and current affairs issues here on ZTN. I'm Robert Mkundiwa. As always, we start by taking a look at Zimbabwe's COVID-19 cases as of the latest data released by the Ministry of Health and Childcare. Zimbabwe now has 8,147 confirmed cases of the novel coronavirus, including 231 deaths and 7,678 recoveries, which puts the national recovery rate at 94%. Now, a paltry 263 PCR tests were done in the last 24 hours, and of those, 37 new cases were recorded of coronavirus. Now, these are all, of course, local transmission cases, with Harare still being the epicenter with 3,291 cases, followed by Bulawayo, which now has 1,570 cases of the novel coronavirus. Now, of course, as we have been showing you, these figures and the low figures of PCR tests are something that we're still worried about, because here on Diplomatic Passport, we always say testing, testing, testing. Now, these low the numbers that we have been recording lately might make some think that COVID-19 is no longer there, but surely it still is with us. Now, many are no longer keen on wearing masks, for example, on wearing masks, and there's a little wind of belief that the disease is not as deadly as previously said. Well, 33-year-old Ukrainian fitness trainer and influencer Dmitry Stuchus, who recently told his 1.1 million followers on Instagram that he did not believe that there was COVID-19, has died from the disease. Now, it's sad he had to find out this way that COVID-19 is there and is real and is a present danger. Now, Dmitry Stuchuk caught the disease during a trip to Turkey and had been taken to hospital upon returning to his native Ukraine, having tested positive. Now, the social media star who promoted healthy living was discharged from hospital after 8 days, but the virus resulted in heart complications, which ultimately led to his death. Now, the situation is not getting any better, as most European countries are going through a second wave of COVID-19 peak phases, and especially the United Kingdom. Now, locally, are we ready for a second wave of the COVID-19 pandemic? Well, Dr. Brighton Chareka, who has always been with us as an expert voice, says we have come a long way, and as such we should not relax, and we should learn from our current experience with the virus.
Way from April up to today now, and we are going to face another wave, whether it comes or doesn't come, but we need to make sure that we are prepared. Failing to plan is planning to fail, but we are much wiser from our experiences.
Cautionary words there from Dr. Chareka. Now, many have pinned hopes on the prospects of a cure or vaccine for COVID-19. Now, some in the field of medicine had suggested a concept known as herd immunity, but World Health Organization Director General for Health, of course, Tedros Ghebreyesus, is not so keen to apply this process to the situation. He said that herd immunity is not a scientifically or ethically justifiable strategy for responding to an outbreak, let alone COVID-19 as an epidemic.
Some discussion recently about the concept of reaching so-called herd immunity by letting the virus spread. Herd immunity is a concept used for vaccination, in which a population can be protected from a certain virus if a threshold of vaccination is reached. For example, herd immunity against measles requires about 95% of a population to be vaccinated. The remaining 5% will be protected by the fact that measles will not spread among those who are vaccinated. In other words, herd immunity is achieved by protecting people from a virus, not by exposing them to it. Allowing a dangerous virus that we don't fully understand to run free is simply unethical. It's not an option. But we do have many options. WHO recommends case finding, isolation, testing, compassionate care, contact tracing, quarantine, physical distancing, hand hygiene, masks, respiratory etiquette, ventilation, avoiding crowds, and more. This is what countries are proving works every day.
So Tedros Ghebreyesus there saying we cannot let this disease to run unbridled like a free horse, and that we need to rein it in indeed, because he says we need to have immunity by protecting our people rather than exposing them, because of course it is unethical. And he raises a very important issue there, saying that we actually still do not understand this disease fully. So to let it roam around within our circles and our society would be playing with fire and absolutely dangerous. And there he is advocating against herd immunity. Now, October is Mental Health Awareness Month, and here on Diplomatic Passport we prioritize such issues because the wellness of your mind is of importance to us. Well, today in the studio I'm joined by Nomalanga Machgiwa and Takunda Mandevu, who are part of a team who have developed an interactive WhatsApp-based chatbot, a platform focused on improving mental health awareness developed by the Zimbabwe Medical Students Association, ZIMSA. Now, it includes 4 key areas: a simple self-assessment question and answer Mythbusters quiz to test mental health knowledge and perceptions. Lady and gentlemen, welcome to Diplomatic Passport, and pleasure to have you.
Thank you.
Thank you.
I'll start with you and say, tell us about this bot. Why did you decide, well, we may as a people need to have this bot to interact with?
The concept of the bot is to allow easy access to mental health information across the spectrum, from people who want to know about mental health in general, but also people who want to be specific in their details. The idea is that if someone can have information that is readily available to them, they may be able to pick up signs very quickly. If they're not coping with stresses at home or at work or at school, they're able to quickly get help. That is the main concept of it, especially now, of course, that we're dealing with this social distancing I hear you talking about.
Absolutely, and COVID-19. And of course, this is something you developed perhaps at the end of COVID-19, and you wanted to roll it out. And I know you were saying it was blown out of the water in terms of launching it because of COVID-19. But how has COVID-19 in fact become an opportunity? Because it seems that we're more stressed now in the era of COVID-19 than when you actually originally produced that bot.
Well, I would say that with COVID-19, social distancing and isolation and everything, it has become important to have something that is online, something that people can access at home and they don't need to interact with other people. And as well as dealing with the stress of COVID-19 itself, the illness itself for people who have survived it, the stigma also that is surrounding COVID-19 as well. Those are some of the pressures that people are facing and that the bot can really help with as well.
And this is the thing really, because I wanted to ask you in particular, Nomalanga, with regards interacting with a bot. You decided people may want to interact with a bot on their phone because they may not really be willing to go and actually seek help. Tell us about that aspect of mental health where even all things being equal, especially men, and we know that perhaps 3 out of every 4 successful suicides committed are by men. And yet men, even if it's the common cold, ordinarily don't want to go and see a doctor. Never mind something that is stigmatized like mental health. Tell us that concept with regards creating a bot.
Well, what we had in mind was that mental health is still highly stigmatized in our community. People see it as a social issue and something that you should deal with personally, you should be able to deal with. And having a mental illness or having a problem or actually seeking help or needing help is maybe seen as a weakness. So people tend to shy away from seeking help and speaking out about their mental health problems. And even if you look at everyday stresses, financial stresses, academic stresses, relationship stresses, these are things that happen every day, and the tendency is for people to think that you have to be strong enough to deal with that, but you can actually seek help. And with us developing the bot, it was saying that people need to know that mental illness is an illness. It's not a social problem. It's not something that you can.
And it's not a curse, because
yes,
there's always that. And I understand you also address these myths. Just in brief, I know we're going to play something that at least tries to go a bit in depth to talk about the bot and what it does. But just perhaps you can just elaborate in short what the bot can achieve and those 4 pillars that we talked about.
So we've got 4 pillars. The first pillar deals with a self-assessment. It's for someone who just wants to find out where they are in their lives with regards to their mental health. At the end of the assessment, it gives them a summary of what they need to do, if they need to get a follow-up checkup or if they're fine. That's the first one. The second part looks at myths. So it's a quiz, basically, where it gives you questions, you answer back. Tells you if you're right and why you're right, if you're wrong, why you're wrong. Then after you look at the quiz, we've got help. So you just type in help. And what it does is it gives you hotlines, whether it's for suicide, gender-based violence. We're coming up to 16 days of activism soon, among other things. So it's, if you need help, then you can. The last aspect of it is to look at how do you get advice in terms of mental health. Basic stuff. Take care of yourself. Surround yourself with the right people. Take care of your body, amongst other things. Those are the 4 areas.
Okay. Now, for some who may actually be wondering how that works, let's see some practical example of the bot at work. So there you have it. Perhaps I want to look at your guys as an organization. What's the story behind the development? Are you working with other partners as a body, or you just sat down one day and you decided this is, I don't know, Nomana?
Well, our project is called the Imunzi Project.
Okay.
It's a collaborative project. The Imunzi Project.
Imunzi, what does that mean?
Well, it's the first letters of each of the organization's names.
Okay.
So the IM is for IMCC, which is the International Medical Cooperation Committee in Denmark. And then the UN is for UNICA, which is the United Children of Africa. And then the ZI is the Zimbabwe Medical Students Association.
Okay.
So this is a collaborative project between 3 partners. And we sat down and we were trying to see what we can do as young people to improve the health of other young people in Zimbabwe. So initially, we were dealing with HIV and AIDS, sexual and reproductive health as well. And then last year, that's when we decided to broaden our scope and include mental health as well.
And that's the thing, really, because we used to look at certain things in isolation and in silos, HIV and AIDS, and now we've got COVID, and nobody really used to get into the matrix of the fact that there's a standalone pillar which is mental health. We only knew that, of course, after that you need to talk to a therapist to help you come to terms with whatever prognosis that has been reached. But we never really saw this as a very important integral part of this. And perhaps you look at why the uptake has looked bad, and what you want to do with this app going forward to at least perhaps try and push it so that it's something that a lot of people take seriously and would want to have on their phone, or at least want to explore.
So taking a bit back, we were talking about how mental health is stigmatized. We were talking earlier about how men can't go for a basic checkup. Yeah. But when it comes now to mental health, it's something that we don't even talk about as a society. And the concept behind this bot is that we need to destigmatize it. We need to talk about it more on platforms like ZTN, where we address mental health. It's not necessarily that you need to go and see a psychiatrist. The basic things, the loss of a loved one, basic anxiety, financial constraints. Those are the things that we have been told classically to toughen up and we'll sail through. And that's the stuff that we're saying we need to talk about it more, because it can affect people. The strongest people in families are the ones who are suffering strokes because they were carrying the burden of the family.
Absolutely.
So the idea behind this now, the bot, is to say, before we can talk about it in public, we want to acknowledge it personally. So even without anyone talking to you about it, go through it, see where you are. See if you need help. If you've got a relative that you think needs help, if you've got a friend that you think needs help, introduce them to the application so that they are oriented with where they are in terms of their mental health. Thereafter, the idea is we're looking at school children initially. The stresses the school children meet, academic, at home.
And this year has been phenomenal. They didn't know when they would write, if they would write, where they would write from, how they would write.
Exactly. And now they have to write in a few short months. Yeah. So the stresses that they experience, classically we've been told to toughen up. We're medical students. Classically we're told to toughen up, but people break under that pressure, the stresses, the depression. And it's our hope that this application allows people to recognize these things early and to act quickly.
Absolutely. Well, of course, if you would want to comment on these and other issues, keep your contributions coming to my Twitter handle at ZimRobbie, that's ZimRobbie, or my email address on robinkundiwa@gmail.com. And of course, we need to keep talking about these issues going forward, because we need to amplify issues around mental health this month. We need to amplify issues to do with breast cancer this month. And of course, we're celebrating the International Day of the Girl. And those are things that we really need to amplify going forward over and over again. And if it means we're going to sound like a broken record, of course, we're going to do that. Now, before we just close, I'm just going to give this to Nomalanga.
That's fine. That's all right.
Just tell us where people can access that application and perhaps your social media handles if anybody wants to get in touch and follow up on that.
Okay, with the bot, you can access it on a number that was displayed on the video.
Okay.
We also have the link to the bot on our social media pages. On Instagram, it's Imunzi Project. On Twitter, it's at ImunziP. And on Facebook, it's Imunzi.
Okay, brilliant.
Don't forget our website.
Oh yes, and our website.
Oh, brilliant. No, it's been an absolute pleasure having you here, and certainly it's selfless when people start thinking of the mental health of others. We always seem to worry about things that are closest to us the most, and we leave, other little areas that have never been touched or have hardly been touched. And as you were saying, sexual and reproductive health and rights has been right at the top, and we've been neglecting things that are as very basic as our mental health, because whatever we do comes from our mental space. But today, that's all for today. But before we close, we've got one of our prominent people who's been, of course, raising the flag of Zimbabwe as an artist out there in the diaspora. Vusa Mkaya. Vusa is an artist in Europe, and he's very well celebrated and a key friend of us here on ZTN. And of course, just before his birthday, the last weekend before his birthday, which happens to be today, of course, he recorded something very interesting. Now, of course, I was going on on my diplomatic passport in Bulawayo over the last weekend. I will tell you that the John Vuli Gate is a very, very big thing right now, and it's big on the scene. And he decided to put a little bit of a twist on it. This is what he decided to do with it.
John Vuli Gate, John Vuli Gate, Nancy Stogo, Nancy Stogo, John Vuli Gate, John Vuli Gate, Nancy Stogo, Nancy Stogo, choose my cat, Vula, Vula, Yababona, Vula, 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 choose my cat, Vula, Vula, Yababona, Vula, Vula, John Vuli Gate, John Vuli Gate, Nancy Stogo, Nancy Stogo, John Vuli Gate, John Vuli Gate, Nancy.
You couldn't make that up. You couldn't make that up. And a beautiful voice there. And happy birthday to Vusamkaya, who's always supporting us here on Zimbabwe's television network on a number of other shows that we carry. Now, until tomorrow, your diplomatic passport has been stamped. Have a great evening.